So let's talk about the rule that was finalized in April, just last month, for the 2025 plan year. Now, as we talk about this rule, I want you to know that it primarily is addressing some of the problems that exist within the Medicare Advantage system. There are, what I think, 30 million people a day that are on Advantage plans, so a lot of people are, and as these Advantage plans have grown, the complaints have also grown. And so this year, it really was about amending some of those abuses and really the disadvantage of the Advantage plan. And so you'll see as I go through this, that's what they're talking about. And so first off, what was a big issue with Advantage plans was the need for additional behavioral health to be covered, marriage therapists and different therapists that were not really part of the original Medicare system. Therefore, people could not go to them for services. And so now they're adding marriage therapists as well as family counselors so that those people can get counseling services from them and still be paid. And so that was one addition. Another problem with the Advantage plans is the agents are incentivized to push Advantage plans. Advantage plans pay us a very good commission, but there's some plans that will even pay a higher than normal commission and give a bonus to agents who promote a certain plan. And that really is abusing the system, because what our job as agents is to make sure that we are trying to figure out what is best for you, not what is best for our pocketbook, but what is best for you based upon your health needs and the providers that you need to see. And so when these plans are incentivizing agents to push a particular plan, what is their goal? Their goal is to make a higher commission, not take care of these needs. So what Medicare final rule said is that there's just one payment that can be paid to an agent, and that's it. There cannot be an additional bonus paid out. I will let you know that when a client enrolls into an Advantage plan, the agent receives a very high commission. In fact, we make twice as much money on Advantage plans than we would on a traditional supplemental plan. And that's why some agents only want to talk about Advantage plans, because the compensation is very, very high. And so my view is that if you're talking to an agent that only wants to talk about Advantage plans, then I know what their concern is. It's their commission. If an agent will talk about all your options, then I believe you're dealing with someone that's ethical, someone that will explain original Medicare, traditional Medicare with supplemental plans, and as well as Advantage plans. We write Advantage plans as a company because sometimes it really is a very good fit for people, but it's not the best fit for everyone. And so people have to really understand what they're getting. And so when you see the commercials, those commercials are trying to portray this plan as though it's going to be wonderful because of all these additional benefits, but they don't talk about some of the issues. And one of the issues with Advantage plans that was addressed in the final rule was pre-authorizations. A lot of people don't realize that when you enroll into an Advantage plan, the insurance company has the final say-so for your health care services. And about 70 to 72% of those services are going to require the insurance company to agree with what the doctor is recommending before that service is covered. In other words, they have to approve. And many times they don't. They say, no, you don't need a knee replacement, you need therapy, or we're not going to pay for a full hip replacement, we'll pay for a rod only. Or we believe you should leave this skilled nursing facility within 18 days, even when the doctor says there's clinical evidence you ought to stay longer. And so Medicare is trying to really crack down on the abuses within the pre-authorization system. And so what they're doing, instead of allowing the Advantage plan to have 2 weeks to decide, now they have 1 week to decide in non-emergency situations. And so hopefully that will help, but they still have the right to say no. And that's one of the really the downfalls of the Advantage plan. It's not your doctor that has the final say, so it truly is the insurance company. Run interference. And why would they do that? Well, because you're getting into their profits, and they don't like that. And so that's one of the reasons I think people that get Advantage plans, I know, are eventually going to be disappointed if they get sick, because they're going to have to go through that pre-authorization process. In fact, there's hospital groups and doctor groups that have dropped Advantage plans fully because they're tired of the pre-authorization system. And so again, they're trying to address that as well. Another thing that is going on within the Advantage system is that we have organizations that actually run ads on TV, and they take that lead and will actually sell it to multiple vendors. And it's a violation of the rules, because no one is even supposed to cold call someone who's interested in an Advantage plan. And so they're trying to break down that and really stop the abuse that's occurring within the Advantage system when it comes to third-party marketing organizations. And so I will tell you this, I think it's going to be very difficult for them to police that particular change. I think there'll still be all kinds of abuses, but again, they're trying their best to make that change. And then also, and I'm going to kind of conclude with this, this is one of the biggest changes. You all who are familiar with Medicare Advantage plans know that there are these extra benefits, which is usually dental, vision, hearing, gym membership, those kind of things. And they are highly, highly advertised, but they're also highly underused, are not used by people. They may have network problems. They may not know exactly how to use the benefits. So they sound real good, but the majority of people are not using them. And so the government is making the Advantage companies reach out to their recipients around the month of June to say, hey, you haven't been using these services. We want to remind you that they're available. Because the government's saying, hey, we're advertising these and people aren't using them, and they would like the companies to make sure to remind people, hey, use these benefits. And so, again, that's something that needs to happen, and so hopefully we'll see something good come out of that as well. So those are really the primary things. You can see it was all about Advantage plans because of the popularity of them as well as really the abuse by these companies. And so these companies are making billions of dollars today off of Medicare as they get this flat fee from Medicare. And I don't profit them from, really begrudge them for making a profit, but many times their profit, I think, comes because they're denying services or delaying services. And that's one of the biggest issues that I have with Advantage plans. So let's talk about when someone does go on Medicare, because I know several of you are going to have questions about that. We want to make sure that when you go on Medicare, you understand that you're going to have to decide how you want your insurance to work. How do you want it to look? And you have two options. You have traditional Medicare with a supplemental plan to fill in the financial gaps, or you have this Medicare Advantage system. And with the traditional Medicare, the reason I like that system is because doctor does have the final say so. I never have to have an insurance company approve anything. If Medicare says they'll cover something, it's covered. I don't have to deal with that kind of an issue. The other thing I like is with the original Medicare and supplemental plans, we have no networks. We don't have to deal with HMOs and PPOs. We don't have to worry about is our doctor going to take the plan, because if the doctor takes original Medicare, that doc will take our supplemental plan of choice. Okay, so those are some of the things that I think are advantageous to traditional Medicare with subs. Now, we don't make as much money as we would if you got an Advantage plan, but I'm convinced that you really have better quality insurance. And so that's what you're going to have to decide when you go on Medicare. All right, and so I want to pause there. Let's start taking some questions, and let's see if we can provide some help for some of you. All right, this is Angel. She says, I signed up for AARP, United Healthcare, on October 1st, 2023, Plan G. Question, does Plan G and Plan N pay for an ambulance to and from a hospital if needed? And thanks for all you do for me. Well, yes, if there is a need, medical need of transportation to the hospital from your home or from wherever, then the ambulance will be covered. So when you say from the hospital, so no, they're going to get you to the hospital. If there has to be a transfer from one hospital to another, then they would certainly pay for that. But it's just going to be that one-way trip. It's not going to get you, back home. So Plan G and Plan N would both do that because original Medicare covers those items, and your G Plan, N Plan would then pay the 20% coinsurance. All right, Barbara, I plan on getting Medicare next year. If I pick a plan and I'm not happy with it, could I change mid-year? All right, so it really just depends on, Barbara, what you start with. So if you start with, let's say you decide to stay with the original Medicare and get a supplemental plan, I'd have to know exactly where you live. But the majority of states, what happens is you can take a supplemental plan when you first go on Medicare A and B. The key date for this is the B date of Medicare. You're in what we call your Medigap open enrollment period, which lasts 6 months of your B date. So let's say someone started Medicare 5/1 this year, 5/1/2024, and that was their B date. They can actually apply for a Medicare supplemental plan 3 to 6 months in advance so that when their Medicare begins, their supplemental plan begins at the same time, in my example, 5/1. But if they have not selected a supplemental plan yet, they still have 6 months. So that would be all of May, June, July, August, September, October. So they have all the way up until October to enroll into a supplemental plan with no underwriting whatsoever. No health question will be asked. That insurance company must cover your pre-existing conditions. They must approve your policy. But after 6 months of that B date, in order for you to get a supplemental plan, now you're going to have to medically qualify. And so there are rules when you want a supplemental plan, and the most important rule is that you want to get it within 6 months of your B date or before. Most people do it in advance, but no more than 6 months later, because unless you live in New York, Connecticut, Vermont, Maine, or Massachusetts, then you are not going to be able to get a supplemental plan in the future without medical underwriting. So that's your once-in-a-lifetime opportunity to do that, except in those 5 states, they have a little bit more consumer-friendly rules. All right, so that's how it's going to work, Barb. All right, Gregory, I cannot grasp this concept. If a plan from any company, for let's say Plan G, is the lowest premium, how is it not the best deal now and later unless companies change an charge an artificially low price to begin? Okay, so the way it works is when you get a Plan G, regardless of the insurance company you select, the coverage will be the same. It doesn't matter whether you go with ABC Insurance Company, XYZ Insurance Company, Aetna, Humana, Cigna, United Healthcare, whoever you go with, if you have a Plan G, the coverage is the same, which means the same bills are paid, the same type of bills, the same amount of bills. So you would never select a company because you think they're going to pay better than another company, because it doesn't work that way. So coverage is the same. What's different is the initial premium, and that's what you're talking about. And so the reason for that is because every company has a different profit margin. They have different markets where they may be a little bit more aggressive with price than another. It's the same thing with auto policies and homeowners policies. A company can be more aggressive and price better in a certain market. Why? Because they want to write more business there. So that's oftentimes why you will see initial premiums that are going to vary. It's the company that sets the premiums, and they may want to be more aggressive in an area. We have a county that we're real close to where our home office is. That's one of the healthiest counties in the state of Kansas. Insurance companies are pretty aggressive in pricing because it's such a healthy county. And so it's the company that sets the premium, and so their profit margins are going to vary. And so what happens is what we believe is going to give you stability of rates, and I think that's really what you're talking about here, is you want to go with a company that is proven to be rate stable. And we can look back for the last 10 years and see how many price increases that have occurred, how drastic those price increases were, how frequent they were. And so we look at the last 10 years of history because I think that's going to give us a good idea as to what they're going to do in the future. And we like a company that has a large market share. One of the most extreme cases we had recently, we had a lady that called in, I think it was from Ohio, and she was looking at a company that had, I think, 600 or 700 policies in their book of business in that area. We looked at a national carrier, and they actually had 33,000 policyholders in that same market. Well, which one do you think is going to be most stable? Well, the company that has the largest market share because they have more people in that group, and therefore the risk for that group is going to be spread out to more policy holders. So that's what you're looking for. You're looking for a company that, yes, has a good, fair, reasonable initial premium, but one that is proven to be rate stable over the last 10 years. All right, Mike, I am almost 66 and a half. Do I have to sign up for any type of Medicare if I'm still working with corporate insurance coverage? And Mike, as long as your employer has 20 employees on the payroll or more, you do not have to enroll into Medicare A or B. Now, if you do enroll in A, that's fine unless you have an HSA. So, Mike, if you have an HSA, I wouldn't do anything with Medicare. You're not going to be penalized at all. Because once someone enrolls in Medicare A, they cannot put any new money into their HSA. So again, if I retire, and so you don't have to sign up for anything. Now, if your employer has 19 employees on the payroll or less, now you have to enroll into Medicare A and B. You're supposed to, really at 65, because Medicare becomes the first payer in small groups, and then your group plan, of course, your employer plan would be the second payer. So presently, I'm assuming you're with a large employer. You do not have to do a thing at all. You're fine, and you'll not be penalized. You're going to come into Medicare at a later date using what is called the special enrollment period. And the key to that is as long as you've had employment or your spouse has been employed and covered by a group employer-provided plan back to 65. We have to verify credible coverage back to 65, and if we can prove that credible coverage, then you will come into Medicare when you're ready to retire. No penalties, no problems whatsoever. All right, Casey, I got an IRMA due to a one-time payment. I have nowhere near that income, but it barely put me over. Do I submit and state it was a loss of income? Well, Casey, the way you appeal your IRMA, and for those of you that would be new to this, what's happened here is that she is above the income thresholds that establishes our Part B premiums. Those income thresholds for single people this year are $103,000. So if I'm below $103,000, modified adjusted gross income. If I'm a couple, if we're below $206,000, we do not have IRMAs. We do not have these additional surcharges added to our Part B premiums. So, Casey, you're either above 103 as single or you're above 206 as a married person. So that's why you have this IRMA. So this one-time payment, I'm not sure exactly what that was, but if it was reported as income, then it's going to be held against you. So what you can do, if you have an appealable offense, which means in the last 2 years, either now or within the last 2 years, you have had a loss of employment, meaning you retired or you semi-retired, then you can appeal that IRMA. Or if you have a loss of income because of a death or a divorce, then if there's a life-changing event, there's 8 possible choices. And if we qualify for one of those life-changing events, then we can ask them to not hold that one-time payment against us that they're getting from your 2022 return. And you can give them new information for 2023 or 2024. But if you do not have one of those life-changing events that you qualify for, you're going to have to pay your IRMA, at least for this year, for the 2024 tax season. Okay. All right. IRMA, please clarify this acronym. So it stands for Income Related Monthly Adjustment Amount. Income-related monthly adjustment amount. And this has to do with Medicare Part B as well as Medicare Part D, the drug plans. And so we have thresholds that determine how much we have to pay for our Part B premium. That threshold, as I just said, is a single person, you got to be below 103, a married couple below 206. And so if we're above those thresholds, then we have this income-related monthly adjustment amount. And there's actually 5 levels of IRMAs. The lowest IRMA right now, monthly, is about $85 a month. The highest is about $500 a month. And again, just depends on where you fall in the income thresholds will determine whether you'll pay extra for B as well as D. All right, niece, Leonard, hi. How many physical therapy sessions will Medicare allow? I have a Plan G. Okay, I do not think that there is a limit to physical therapy sessions, but here's the criteria. There could be some limits based upon, are you improving? In other words, how is the progress of that? So that physical therapist that is seeing you, I know there are some things that they're looking at to see if you're making improvements. So if there's no longer any improvement, then I believe that there could be some kind of a limit. But I think as long as you're improved, then I think those will continue on. And really, folks, in this scenario, because it's so specifically tied to physical therapy, I would ask your physical therapy provider, what's the typical allotment of visits for, maybe a knee replacement or therapy for that. So find out, and they'll let you know. But I do know that there's not a specific limit to those. It's just going to be determined on how much progress that you're making. Okay, how does Medigap pricing work in South Florida? I'm concerned about signing up for Plan G or N, then see multiple rate hikes throughout the year. I've read Facebook posts about 2 or 3 hikes in a year. All right. It is true that supplemental plans are pricier in Florida for sure, throughout Florida. It is a market that is very strong with Advantage plans, so you don't have as many people buying supplemental plans. So I think that's one of the reasons the prices are higher. Secondly, what happens in the state of Florida, it is what is called an issue age state. when that insurance company sets their initial premium, it's called issue age. That means that you're going to pay a premium based upon your age, and that premium then can never go up again because of age. It can go up because of a group increase, but it can't go up because of age. And so that's why those price points are a little higher. The highest pricing strategy right now is community rated, which Florida is not, but it's the highest. And then issue age is the next, and then your lowest pricing method is called attained age, and that's what the majority of states are. So that's why you're seeing high prices. It's a Medicare Advantage state, and because of the issue age requirement placed upon people that are in Florida. And now, as far as 2 or 3 price hikes in a year, let me clarify that. That is very rare. Most insurance companies lock the rate in for 12 months. We'll see an annual adjustment. So what's happened here is United Healthcare is the one that primarily this is probably coming from. United Healthcare takes an increase at your birthday. Because they have an enrollment discount, and you lose that enrollment discount about 3% every year. So that looks like it's a price increase when it's really not. It's just you're losing the enrollment discount. And then they also could take a group increase. And they actually do that at 2 separate times of the year. So it really is an annual increase, but they split it up in 2 different ways. Okay, so I know it's a little bit confusing with them, but that is the way that it works in Florida. All right, next. Okay, Cindy, it is difficult to switch from Plan G to an Advantage plan after 2 years on G. Is it difficult? No, it's not. Cindy, the way that works, though, is you can only do that once a year. And it's a 7-week period, and it's October 15th through December 7th. So if I'm on a G plan, N plan, or whatever you're on, and you want to switch to an Advantage, you'll be on your supplemental plan the whole year. But you have to make that switch October 15th through December 7th. There's no underwriting required. If you have a plan that's in your zip code, you can have it. There's no health questions asked. So as long as it's in your what we call a service area, which is basically a geographical regional area, then you can get that plan. Make the switch October 15th, December 7th, and that plan that you decide on then will go into effect January 1. And so then you would call and cancel your supplemental plan, whoever you're with, call the customer service line on the back of your card, and you'd call them in December and let them know that effective January 1, you no longer want your supplemental plan. All right, so really a very, very easy process. Just remember, though, you're going to be in a different system, and that is you're going to have to deal with networks, pre-authorizations, and then if you stay on that Advantage plan more than a year plus, now you're going to have to medically qualify to get another supplemental plan. And so if you're comfortable with those criteria, it is fine to make that switch. Donna, what is the cheapest way to take care of your eyes and teeth without an Advantage plan? Okay, well, right now, I would say the average good dental plan is going to be in the neighborhood of about $45 to $50 a month. That's the dental side. And most of those plans are going to give you 2 cleanings a year, a set of x-rays, and they'll cover up to about $3,000 in other dental benefits, extractions, fillings, crowns. So that's $3,000 a year. And again, those run about $45 to $50 a month. And then if you want a vision plan, then you can get an add-on to that. And those normally, it's the VSP networks, about $10 or $11 a month. And the, excuse me, that's not true. IMED network is usually $10 or $11 a month. And then VSP is about $15 to $16 a month. Now, I want to add something here. If you have traditional Medicare with a supplemental plan, you have wonderful vision already because the only thing that's not covered would be your eyewear, which is contacts or glasses. Medicare doesn't cover those, and Medicare doesn't cover eye exams for eyewear. They'll cover eye exams if they're medically necessary. They cover glaucoma, cataracts, macular degeneration, shots in the eye, wet or dry. So you have great coverage already. But if you want something for eyewear and that one eye exam a year, that would be, just for prescriptions, then you can get a vision plan. Here's the way it works. About 75% of all people that are on traditional Medicare get some type of a dental plan. And I would say probably maybe another 25% may get vision because they have such good coverage anyways with traditional Medicare. David, is it better to be on a Advantage plan if you're healthy and a supplemental plan if you have a lot of medical conditions? I would tell you this, if I had health problems, I would not want to be on an Advantage plan for sure. And so if I had a crystal ball, David, and I knew I'm never going to get sick, I'm never going to have any cancer or have any kind of health problems, then I would certainly select an Advantage plan. I would. But the problem is we don't have a crystal ball. We don't know what's going to happen. Things can turn very quickly in our health. And so if I'm on an Advantage plan, and I've been on the Advantage plan for 2, 3, 4 years, and I get sick and now I want to move to a supplemental plan, you're not going to medically qualify. You can't make that move once you're sick. And so that's the problem. We really have to decide, am I comfortable taking on the risk that if I'm on this Advantage plan for any length of time and now my health changes, I can't get off? Because insurance companies, other than in New York, Connecticut, Vermont, Maine, Massachusetts, unless you live there, the insurance companies do not have to take you. You have to medically qualify to get off the Advantage and move to a sup. And so that's why, listen, I am 63. I'll be in Medicare in a year and a half. I know what I'm going to do. I'm going to take a supplemental plan for sure. I can afford it. The supplemental plans in most states right now are about $125, $130 for a G, around $100 for an N plan. Now, listen, you may live somewhere where they're higher or lower. I'm just saying average. And so I can afford that in my budget to get premium quality medical insurance. When you get an Advantage plan, even the government does not call those premium quality insurance. They call them low medical coverage. High in perks, gym membership, dental allowance, hearing aids, all that, high in that, but low in medical coverage because of networks, pre-authorizations, and just the issues you're going to have to deal with on the Advantage plan. So you got to decide, do you want high perks and low medical coverage? Get an Advantage plan. If you want high medical coverage and low perks or no perks, then you get a supplemental plan. Are the premiums for Part D drug plans expected to increase significantly since there will be a $3,000 limit? Yeah, well, number one, Bobby, the limit's $2,000 next year. This year it's $3,350. And is the premiums going to go up? Here's the thing. I would suspect that we're going to see some increases. However, when the government made these changes, they put a limit on how high these companies can go, and I think the increase is 6% this year. So I don't think they can drastically go up. Now, what could happen is that they may discontinue some plans and reintroduce some new plans, and so then we don't know where those price points are going to be. We also know that companies may change their formularies. So yes, there's definitely going to be some changes, but those plans are not out yet. The companies are still formulating those plans and getting government approval. They will be out right around October 1st to October 15th. But yes, I suspect there could be some adjustments there. But again, the government's going to limit how much they can raise those. Okay, Andy T. Shout out to Matthew C. It's Matthew Connell from Medicare School. He signed my wife up for a G plan this morning. It was diligent, professional, friendly. Highly recommend. Andy, I'm glad you had a good experience. Matthew, by the way, is a pro. Matthew's actually been in this business longer than I have. He really is a great guy, cares about people. And I hope all of our people do. I hope those of you that have used our company can have really a similar testimony, because that really is our goal. We want you to have a good experience. We do everything we can to make sure that happens. And we're not perfect by any means, but we sure strive to make sure things go well. And Andy, thanks for letting us know that. Okay, William, will IRMA rules change for 2025? Will double taxation continue on Social Security benefits? Okay, well, the only thing that we know of, William, about IRMA rule changes is they almost every year raise the limit. So single this year, remember the limit's $103,000, couples $206. So I would suspect because of inflation, we're going to see those go up a little bit. But as far as the overall IRMA program, I don't see any major adjustments whatsoever. So I don't think that's going to happen. Double taxation continue. I just don't know. I agree with you. I think that they ought to stop making our Social Security benefits subject to taxes. I think that ought to go away. But I know there's some in Congress that have tried to eliminate that. Fortunately, there's some states now that are realizing, hey, we got to stop taxing Social Security benefits. So fewer and fewer states are doing it. But for now, the federal government is still sticking with the provisional income formula. So if you're single and you make below $25,000, zero of your Social Security is taxable. If you're between $25,000 and $34,000, then 50% of your Social Security is taxable. Above 34,000, then 85% is taxable. So all of us are at least have 15% of our Social Security benefits not taxable. If you're married, the number is 34,000 and below, zero taxes. 32 to 44,000, 50% is taxable, and then above 44,000, 85% is taxable. And those numbers are called provisional income. So I hate the system too. I really do. But it is that way presently. Go ahead. Okay, Deborah Bryant, if my husband keeps working till 65 and I will be 70, can I draw half of his benefits then? Or do I get less because he isn't full retirement age? And I'll be 70. Okay, here's what happens. Deborah, there are a couple things. You're not going to be able to draw any benefits from him until he files. Okay, he has to take. In the old days, that didn't happen. So for you to take spousal and get 50% of his amount, he has to be taking his own Social Security benefit. But your benefit, because you're going to take later, will be based upon his full retirement age amount. If he takes 60 at 65, he's going to get a reduction, but you would not. So it's 50% of what he is eligible for at his full retirement age. Okay, so hopefully that answers your question. You would be eligible for 50, but here, keep this in mind. If 100% of your own is more than 50% of his, you're going to get 100% of your own. That's called the deeming provision. And so when they changed the rules a couple years ago, the rule says when you apply now, you have to take the greatest amount available. Okay, 50% of his or 100% of yours. All right, what do you charge? Oh, for your services. Oh, Jack, agents do not charge anything, whether you used our company or whoever you used, because the insurance agent is always paid by the insurance company. So there's no charge at all for our services, and no matter who you go with. And also, there's no extra charge either. So let's say someone is going to go direct with United Healthcare, and the rate's $142 a month. That's exactly the premium you'd pay with us as well. So there's no additional money added because you used a broker. In fact, all the companies pay the insurance agent, not you. What matters, really the difference is the service. What are you going to get? And we really, we're actually proud of the way we do things because we have our own in-house customer service department. Our clients never have to call the insurance company unless they want to. Most call us direct. The problem with calling insurance companies today, about 9 out of 10 calls, you're going to be transferred overseas. You're going to Philippines or India or China someplace, and you may or may not be able to understand them, and a lot of times they don't even understand Medicare very well. So we have our own in-house customer service department. When you call in, it goes right to our team members that I've trained and rub shoulders with every single day. So when you have a problem, you call us, and we'll take care of you. No cost. All right, Stephen R., I had major dental needs, did buy vision, but agent basically said both won't do much. Teeth snapped off, any ideas? Oh boy. Okay, well, I don't know sure why the agent told you not to buy a plan. I think dental plans are very good. I think, Stephen, the deal your issue is going to be you're going to have some pre-existing conditions now, and so it could be that you could get a plan, but some of those things that were pre-existing may not be covered. What I would do is I would try to find a dentist that may have an in-house plan, because a lot of dentists do that. You pay them some kind of a flat fee on an annual basis, and then you get a fairly decent discount from them. And it's all right to enroll in a dental plan, but I would want to find out how some of these pre-existing issues are going to be covered by the plan before you start having to pay the premium. So I'm sorry that happened. I would always encourage people to get a dental plan. And you know, because if you have it and you need it, you'll be glad you have it. If you don't need it, then you can always drop them. But just bad advice from the agent. Not sure why they would do that. Okay, Michael Woods, do I have the ability to change to Medicare within 6 months if I signed up for an Advantage plan? Yes, you do. So what happens, Michael, when we go on A and B, and now we're eligible for an Advantage plan, you can move back to traditional Medicare with the supplemental plan during that. Actually, it's usually a 12-month in most places, at least 6 months. I always tell people try to do it within 6. Some places it could be an additional 6 months, but there's different rules on that, kind of very weedy for tonight's topic, but you definitely can do it within 6 months. So let's go back to my example. Let's say a person started an Advantage plan, let's say February 1st. and they have 6 months beyond their B date, which is February, March, April, May, June, July. They could apply as late as July for an August 1 start date on a supplemental plan with no underwriting whatsoever. So we encourage people to try to make that switch within 6 months of the B date. Some places you can extend that a little bit farther. It just varies state to state. That's right. All right. Wolf 2, is it true that Medicare will bill you for 3 months when you first start on it? Okay. Yes, it is. That's if you're not receiving Social Security benefits. When you're on Social Security, then they're going to take your Part B premium right out of your Social Security check. But if you're not, then what happens is the default billing is quarterly. But if you don't want to pay quarterly, 3 months of your Part B premium, which, what's that, 175 times 3, about $525, what you can do, Wolf 2, you can set up what's called Medicare Easy Pay. And this is what I would do. And you can go online and enroll into Medicare Easy Pay. So then instead of them billing you quarterly, what they will do is they will do a bank draft out of a checking or savings account on a monthly basis on the 20th of each month. So instead of having to pay, quarterly $525, now you just pay the $174.70, and they'll draw it out of a checking account. And then once you go on Social Security, they'll stop those bank drafts, and then they'll just draw it out of your Social Security check. I'm going to also let everyone know this. Your very first bill may be 3 months. I've seen them as high as 5 months. So what happens when you enroll into Medicare for the first time and you're not on Social Security, it's kind of like the lottery. One person gets a 2-month bill, the next one gets 3, next one gets 4 months, the next one gets 5 months. So all day long, the system just rotates through 2, 3, 4, 5 months first time. And then after you've paid that first bill, 2 to 5 months, then it will be quarterly thereafter. I received a Medicare card. Will I receive Plan G and Plan D card? Okay, Al, the reason you received a Medicare card is because you're already on Social Security. So if you just got that in let's say the month of April, which was probably what happened, May, June, July, that means you have an August birth date. You're turning 65 in August, then you should have gotten your card, Medicare card, mailed to you during the month of April. If you're turning 65 in September, then you're going to get the card this month. They normally come around the 15th to the 25th of the month, about 100 days prior to your effective month. The Medicare card is mailed to you if you're on Social Security, but you're not going to be automatically enrolled into a D plan. You're not going to be automatically enrolled in a G plan. Those are decisions you have to make. In fact, we'd love to help you with that. Just call in our office, and one of our Medicare agents can walk you through that process, help you find the G plan or N plan and the right prescription drug plan. But that's something you have to actually initiate that and do that enrollment. We'd be delighted to help you with that process. If you retire for 2 years and would like to return to work part-time, do I have to go with the company insurance? And the answer is no. If you're already on Medicare and you go back to work and the plan's available, you're not required to take it at all. You just say, no, I'm not interested in that. And sometimes when you decline the company insurance, sometimes they actually will pay you a little bit more in salary or hourly rate. But you're not required to go back with the company plan at all. They can't make you, and most people would not do that anyways because Medicare can be very, very attractive. Okay, I'm from Idaho. When I reach my full age of retirement and get a supplemental plan with Part A and B, will I have to get AARP? No, the only company, Giselle, that makes you enroll into AARP would be United Healthcare. They do require that. So if you decide that you want to have a United Healthcare supplemental plan, they require a 1-year membership into AARP. You don't have to keep it beyond 1 year if you don't want to. That's usually about $12 a year, sometimes $16 a year. And then after that year, you can drop that if you'd like. But the first year, yes, with United Healthcare. But if you want to go with Aetna or Cigna or Mutual of Omaha or whoever, they don't require AARP membership at all. AARP and United Healthcare are kind of hand in glove when it comes to supplemental plans. Turning 65 in November, but I have insurance through my spouse. Do I have to enroll for Part A and B, or can I wait until she retires 1 more year? Yeah, Mario, as long as your spouse, her employer, has 20 employees on the payroll or more, you don't have to do anything. You can stay covered by your plan. You're not obligated to do anything with Medicare. You don't have to do A, don't have to do B. It's all right to do A only as long as you don't have an HSA, health savings account. But if you have one of those, do nothing. All right? Is an attained age state? No, it's not. No. New York is a community rated state. And so I wish it was attained age because those rates would be much lower, but it is community rated. So that means the 65-year-old and the 85-year-old get the same price. It's just the way that it works. And that's why those rates are a little bit higher. I will tell you, we run a lot of business in New York, Jenny, and I think the majority of people find that the Plan N is just much more attractive. In New York, they cannot charge excess charges anyways. So as long as you never deal with excess charges, then that N plan should serve you pretty well. I think the rates are much better there. All right, Cynthia, if I'm still working after age 60, does that income in those quarters count toward the amount my Social Security check will be? I believe your video said quarters are counted up to age 60. Okay, Cynthia. No, everything that you're making is still going to affect your Social Security benefit. What I was saying, the video you're talking about was this, that when they're calculating your total lifetime earnings, they take years prior, let's say money I made 20 years ago, money you made 20 years ago, and they apply an index to bring that money up to current dollars today because, $30,000, 20 years ago may be like $100,000 today. So they're going to inflate that up. But once we reach age 60 and we have income beyond that, they don't apply an index to that. They don't inflate that up. It still counts, and it's still helpful for you because remember, they're going to take the top 35 years, but they're not going to inflate that with the index once we hit age 61 and on. It's just going to be dollars, what those dollars are worth today. That's the difference. That makes sense? Okay, good. Sorry about that, Cynthia. That is confusing. All right, I turned 65 mid-February. If I enroll in Medicare tomorrow or anytime before the middle of May, my Medicare would start June 1. Correct. Okay, so you turn in February, so we have March, April, May. You're exactly right. You have all the way through this month, and your Medicare B would start June 1. They'll actually backdate your Medicare A date to your birth month. So you'll have an A date of February 1 and a B date of June 1. That's correct. And by the way, hey, listen, I give you a piece of advice. When you do that, you want to be sure, if you go online and make that enrollment, be sure to put in the comment section, please begin my Medicare June 1, if that's when you want it to start. Because we just had this happen last week. Someone enrolled like what you're doing, and the person who processed it with Medicare backdated their B date. In your example, they backdated February. Well, she didn't want it in February. But now the government said, no, you're going to have to start paying for it as of February. So that person who processed the application probably thought they were helping that lady out, but they weren't. She really did not want to start then. And so now there's a way to undo that, but it's kind of a pain in the neck, and we're helping her through that process. So be sure to specify you want to start your B 6/1, and they'll do it. And if they don't, at least they'll go back and correct it. Okay, did you hear correctly? No, HSA FSA is on Medicare. Okay, what I was saying is this. Not FSA, flexible spending accounts, you can continue to have one of those if you're on Medicare. But if you have any form of Medicare, A and B, whatever you have, no new money can go into your HSA. The HSA money is yours. You just cannot put any more new funds in once you go on Medicare. All right? And so if you want to keep contributing and you're still working, don't enroll in anything. All right, and then just be sure you want to stop contributing to your HSA 6 months prior to retirement. So if you worked age 68, then I would stop contributing about 6 months before you decide to retire because they're going to backdate your A date 6 months. It's very confusing. Call in and we'll help you to determine exactly what's the best day to stop your HSAs. Otherwise, keep contributing. Okay, do I automatically get enrolled next year if I were to receive Survivor Social Security? Yes, you do. You do. Any form of Social Security benefits will then, they will automatically put you into Medicare. Survivor, Spousal, your own retirement benefits. The only difference is disability. Disability is on the 25th month of receiving benefits. But for every other benefit, you're automatically start Medicare A and B at 65. All right, I'm currently on disability. When I turn 67, will my Social Security amount change or will it stay the same? It's going to stay the same, George, because when they calculated your disability payments, it was basically your full retirement age benefit. So it's not going to go up. Now, it can go up because of cost of living adjustments, COLAs, but it's not going to go up because you're moving from disability to full retirement age. That you've already been getting that benefit. Can you switch as often as you like in New York from supplemental plan to Medicare Advantage? And the answer to that would be true. That we call that an open enrollment state. Now, here's the thing. if let's say you're on a supplemental plan, you can't just switch to Advantage plan anytime you want to. You have to do that switch from Sup to Advantage October 15th through December 7th. That's the only time you can do that. Now, you have two periods, October 15th, December 7th, January 1 to March 31. But Sup to Advantage is only once a year, October 15th to December 7th. All right, what does this Plan G actually cover? Alan, Plan G covers all the gaps that exist in original Medicare except one. And so the way to look at it, there's 6 gaps in Medicare. We have 3 gaps on the A, 3 gaps on the B. Those are financial gaps. You can Google those and look at them. 6 gaps in original Medicare. And so the Plan G will cover 5 of the 6 gaps. The only one it does not cover is the once a year Medicare B deductible, and that's $240 this year. Last year it was $226, so it went up a little bit. And I've seen that number kind of go up and down, but it's been low historically. The lowest it's ever been is $100. Highest it's been is what it is today, $240. And that's all you would ever spend out of pocket. As long as Medicare covers something and you're seeing a Medicare provider and you have a Plan G, you meet that B deductible once a year and you're done for the whole year. Everything else, 100% coverage. All right, Ramona, can I switch from PPO Advantage to traditional Medicare with the supplemental plan? Yes, you can do that, but you have to do that one of 2 times a year. I just mentioned those dates. So you can do it January 1 to March 31, which now that time's over. And now later in the year, you can do it from October 15th to December 7th, and then you can get that supplemental plan go into effect January 1. So that's when you can make the switch. Now, I got to keep in mind, if you've been on that Advantage plan more than a year, to make that switch, you're going to have to medically qualify for sure, okay? And so if you're still within that 6 months of your B date, I'd be getting on that if you want to go ahead and get a supplemental plan because there's no underwriting. Okay, does Medicare cover dermatologists? Absolutely. As long as the dermatologist participates in the Medicare system, which 99% of all doctors do, they'll be covered for sure. All right, maybe a stupid question, but does Mayo Clinic participate in Medicare A and B? Oh, yes. Yeah. Mayo Clinic definitely takes traditional Medicare, your supplemental plans, and they'll also take now a few of the Advantage plans. Not all of them for sure. But Mayo Clinic likes Medicare and they like supplemental plans. I can assure you that. Can I switch from PPO Advantage if my Medicare starts May 1 to traditional Medicare with supplemental plan in California? Yes, you can. It's no problem at all. In fact, you're fine. You're still within that window. And I'm assuming, Ramona, that you're new because that's why your plan's starting May 1. So yeah, you can do it in California for sure. Just call us, Ramona. I think California is maybe our 3rd or 4th largest state that we write business in. So be delighted to help you to make that switch. All right, on a Plan F, is it going to be discontinued? Are we safe and will age out when we die? Yeah, the Plan F is no longer available to anyone who starts Medicare after January 1, 2020. That's the only rule. Anyone after starting Medicare after 1/1/2020 can't get an F plan. But anyone started Medicare before then, which is you can keep that plan, Lydia, your whole life. You're not going to lose the plan. You pay the premium, it's yours. So you were grandfathered in. Anyone after 1/1/2020, the most comprehensive plan would be a G plan. But prior to that, F was fine. So it's all yours. Keep paying the premium. And by the way, lady, if you can medically qualify, I'd move to a G or an N. I really would, because you're probably paying a whole lot of money. Let's just compare F and G. The only difference is the annual B deductible, so that's $240. So divide that by 12, that's $20 a month. So if you're paying $30, $40, $50 extra right now for that Plan F, you're paying too much for one little benefit of a Part B deductible. So if you can medically qualify, I'd be moving to a G or to an N. Save some money. And you reset the clock, you'll be in a new group that's going to be younger, so it'll probably be more stable than what your F plan is. All right, how difficult is it to change from N to Plan G? Not real difficult. We're going to have to ask you health questions. There's about 30 of them. And again, call the 800 number. We can go through that with you. It didn't cost any money to try. and our agents will tell you, what the likelihood is. We do field underwriting, so we got a pretty good feel for who can get approved and who can't. We're just going to ask you the health questions. So I always tell people, you don't have to be ready to run a marathon, okay? You don't have to be that healthy. But if you have AFib in your medical records, you're not moving, okay? AFib will be declined if you're taking Eliquis or Xarelto. If you're an insulin-dependent diabetic that's had any complications, retinopathy, neuropathy, diabetic coma, you're not going to get to switch. Spinal stenosis, you'll be declined. Psoriatic arthritis, rheumatoid arthritis, not going to get approved. So certain health conditions, they will decline. But we know all those, so we'll be happy to walk you through the application and see what the likelihood of you switching. And if you get approved, do it. If you apply and get declined, no harm done. It's not like you're blacklisted because you didn't get approved. You just stay where you are. All right. Next one. Okay, do doctors receive more payments from Medicare plus Medigap than from a Medicare Advantage plan? Absolutely, they do. That's why Advantage plans sometimes are dropped by whole hospital groups, whole doctor groups. Why? Because the reimbursement rates are low, and my understanding is Medicare Advantage plans not only pay less, but they pay very, very slow. And those insurance companies hang on to that money. And that's why a lot of doctors don't take them. They're tired of the pre-authorizations, and they're tired of the slow pace. It's just a system. They say, we're not interested in that. It just doesn't work for us. And so they definitely get more money from original Medicare and that supplemental plan. And there's no hassles either. Medicare covers it, end of story. There's no interference, no intervention by the insurance company whatsoever. They don't have a right to do anything but follow Medicare. And that's what's attractive. And by the way, here at Medicare School, we write Med-Sup plans, and of course we write Advantage plans as well. I think about 70% of our clients have supplemental plans, 30% have Advantage. Our main issue is we just want to make sure we are thorough and show you everything that's available in your market. We're brokers, so we write for multiple carriers. We're not beholden to any carrier at all. We have contracts with them. We write their plans, and they pay us. But we're going to find the best situation for you based upon your market, your health conditions, your health concerns, and we'll take the time to do that. When you call in, I promise you, we're not going to push an Advantage plan. If you want one, that's fine, but we're going to talk about the ins and outs of all the plans, making sure you're very confident with your decision. Okay, born in October 1959, not planning to retire yet. At what age can I collect Social Security without any restriction of the amount that I make? Well, your full retirement age is, you have a pen, 66 and 10, so let's count it. Oh, thank you. Yeah, let me just count this out for you real quickly. So October, I'm assuming it's after October 2nd. So you have October, you have November, December, January, February, March, April, May, June, July, August. So that would be August of 2026, right? We take 66 and 59 is 2025. So that's right, August of 2026, you will reach your full retirement age, month and year, okay? And then you can collect Social Security without any kind of reduction. For every month we take early, before full retirement age, we lose 0.5%, so 6% a year in reduction in Social Security. So if you can wait to full retirement age, that's exactly what I'd recommend. So you'll be 66 October of 2025. We add 10 months to that. So that's why I counted November, December, January, February, March, April, May, June, July, August. So August 2026, full retirement age and month. All right. If my wife and I sell a property and has large capital gains, what happens to my IRMA? All right. Well, your capital gains are going to be reported on your tax return, so it is definitely going to affect your Medicare Part B premiums for that particular tax year. So if you sell it this year, that impact is going to hit you in 2026. But here's the good news. If you happen to retire or semi-retire in 25 or 26, then you can tell them, I've had a life-changing event. They won't look back at 2024. You can give them numbers for 25 and 26. So even though you have this large capital gain, if you time it right as far as your retirement goes, that will not be held against you because they do not source that money. They assume your income is just based upon your wages, your commissions, or self-employment income. They don't look at it as though it was capital capital gains because they don't itemize it that way. They look at two things. Line 11, which is your adjusted gross income. They line 2A back in, which is tax-exempt interest. So line 11 plus line 2A it will be the number called modified adjusted gross, and that's what they look at to determine your Part B premium. And so if that's going to be less because of a life-changing event, work reduction, work stoppage, then you have an appealable offense, even though you and I know it wasn't because of income, it was because of the sale of this property. But they don't know that, and they don't care about that. They do not dig that deep is my point. Okay, let's keep going. These guys are the best of educating their clients and no pressure. Hey, thank you, Joan. That is our goal. We want to be your broker, but we don't want to put any pressure on any particular plan. We want you to decide what is best for you. Educate you and you decide. And thank you for the encouragement, Joan. Does your company write plans in California? Absolutely. Yeah, we write all over the country, and I think it's probably our third or fourth state as far as volume of business. So we write lots of business there, and we'll be happy to look at your options for you. Just give us a call, please. All right, Advantage Plan, it's a great plan because I have Medicaid too. And you're right, it's a dual plan. If I lose Medicaid, then what happens? Okay, well, Jack, you still will be eligible for an Advantage Plan, but it will not be the type you're on right now. You're on what's called the dual eligible. We call these dual SNPs. Dual meaning dual eligible, Medicare and Medicaid. SNP is an acronym that stands for Special Needs Plan. So they have a special plan for you in the Advantage system because of your dual eligibility. So if you lost your Medicaid eligibility, then you could still get an Advantage Plan, but it's not going to be quite as attractive as what your dual SNP is. I want to thank you for all your work. I've been watching you for years. I have a Plan G and I've received a 2 operation for skin cancer and only pay the annual deductible. All right, Stephen. I'm glad that you're a client. I'm also glad that you've learned from our channel. I'm in studio right now with our video producer who frankly does most of the work here. I just get to be the face, but together we work hard and we take our job very seriously, and we love producing videos to make sure people are educated. So thanks for the encouragement, Stephen. All right, Rick, had an excellent supplement. Then I moved to South America and gave up Medicare. Now, years later, if I come back to Pennsylvania, how big of a penalty do I pay? Okay, Rick, I'm assuming, okay, you did drop Medicare A and B, it looks like. You know, I will tell you, here's the way it works. And let me say this first. I'm not highly versed in your situation. I've had it come up, but it's been, you know, a handful of times in my 15 years in this business. So I'm not real up to date on this. So let me share this with you. The rules are this: for every 12 months that we go without Medicare Part B, it's a full 12 months when we should have had it and we didn't. You moved away, let's say 5 years, and that's 60 months. Then you're going to have a 50% penalty. So for every 12 months, we have a 10% penalty added to our Part B premium. So 2 years, 20%, 3 years, 30%, you see that. And it's a lifetime penalty, okay? Now, Medicare A, I'm assuming you didn't drop that because it's free. So hopefully you didn't. But the way that works is if you did drop A, then that is also a 10% penalty for every 12 months, but it's not forever like Part B. So if I go without A, let's say 2 years, 20% penalty, and I pay it for 4 years. So it's a percentage, and then we double the years. So if I went without 3 years, 30% penalty, I pay it for 6 years. Okay, so B penalties are lifetime. So what I would do, contact your local Social Security office, and let's see what the criteria are, because you did have coverage in South America, and we'll see if they would consider that as credible coverage and maybe reduce your penalty. But the local Social Security office should be able to help you with that. And you may be able to call Medicare, but normally we only call Medicare when we have a claim problem. We have an enrollment issue, something like you're dealing with. We just deal with a local Social Security office. All right, can you start a dental plan anytime, or do you have to wait till? No, dental plans are standalone plans. You can add those any time that you want to, Sue. Now, if you get an Advantage plan that has a dental benefit, then of course you're going to have to do that during open enrollment. But if you just want a standalone dental plan, a good dental plan, then anytime. In fact, we write them, call our office, we'd be happy to help you. All right, what's up? Okay, the premiums I pay for Plan G, tax deductible. Okay, let me tell you how this works. Possibly, but probably not. And here's why. Because number one, the only way you can deduct any kind of medical expenses is if your expenses, what they do is they take your adjusted gross income, line 11, and if you have medical expenses that exceed 7.5% of your adjusted gross income, anything above 7.5% becomes deductible. So whatever your AGI is, that first 7.5%, anything below there, not deductible. Anything above that would be deductible. And so when you itemize and you bring in your Plan G premiums, those could be deductible. But again, it has to be anything above 7.5% of your AGI. That's what I'm saying, unlikely. So if you just use the standard deduction and you don't itemize, then the answer to your question is for sure no. But if you itemize, it could be possible. All right, some vets with TriCare get tricked into buying an Advantage plan even though TriCare pays nearly all medical that Medicare doesn't pay. Okay, I would say this to you, Zach. I wouldn't call it a trick. It is true that TriCare is some of the best insurance there is, and I'm glad that our government gives our veterans that kind of insurance. Okay, so here's the way it works. If a person has TriCare and now they're 65, they enroll in A and B, and it is true that TriCare will pick up the full balance. Wonderful insurance, and it also includes credible drug coverage. So that's awesome. And I tell vets that have that, you have the best insurance going. And the reason, though, some veterans will take an Advantage plan is because of this. They do it for a reason, and that is because there's perks with the Advantage plan that TriCare doesn't offer. Plus, that Advantage company almost always gives them a credit towards their Part B premium. I've seen it as much as $150 a month. So that's why veterans doing it. So they're really not tricking. It's just a benefit that the Advantage plan can offer because the veteran continues to get their drugs through TriCare insurance. And so that Medicare Advantage company takes some of that money they get from the government and they give that back to the veteran, to the TriCare recipient. Okay. The only negative of that is when they do that, they still have to have that PPO network with the Advantage. But as long as their doctors and hospital are covered, there's really no harm done at all. Plus, it's not a permanent decision. So if the veteran decides to go on the Advantage and a year later they don't like it, they're not bound to that. They can come off of it and just go back in A and B with their TriCare insurance. So they really haven't hurt themselves. So I wouldn't call it a trick. I really mean that. They don't have to do it, but if they like the benefits of it, the perks as well as the Part B reduction, then I'd say go for it. If you don't like it, go back. You're not bound to it. Okay, when is the earliest someone who is 65 should turn in paperwork for Medicare? I lose my work health insurance the month I turn 65. Well, the right time is about, the earliest time really is about 90 days prior. So when you take your birth month, back up 3 months, and it's time to get busy. So right now, anyone that we're working with now, May, June, July, most people we're working with now have a birthday in August. About 3 months prior. 90 days is really the ideal time. Now you can do it one day before you turn 65. You're not going to have your card, but you're still going to be eligible to do that. So 90 days, perfect time. Okay, does your company work within all states? Yes, Cheryl. We're in all 50 states and the District of Columbia. We write the majority of plans in each of those states. Happy to help. Just give us a call. All right, do I wait to get my Social Security card A and B before I start my supplemental plan? No, you don't have to. Most people are going to set up their supplemental coverage anywhere from 90 days prior to when their Medicare is going to start. So if you're on Social Security and you know your card's going to show up, it's time to start doing that now. Most states, the insurance companies will allow us to submit MedSup plans anywhere between 3 to 6 months in advance. And that's what most people do. They get all this set up in advance. Okay? And each state varies, but we can tell you those rules if you want to give us a call. Is there a deductible on Part A? And there is. The deductible this year in Part A is $1,632, $1,632. But if you get a supplemental plan, any of the letters will cover. Now, let me back up. That's not true. That is not true. The top plans, your F plan, G plan, N plan, those will cover the A deductible. Okay, there's a couple plans. MedSup A does not, MedSup B does not, and MedSup K plan pays 50% of it. MedSup L plan pays 75% of the A deductible. But again, most people don't get those. Most people get F, G, or N. and it will cover the deductible and multiple times, because that deductible is not annual. It can't happen more than once in a year. So supplemental plans will cover it. $1,632. Sorry. All right. Okay, when would be the best time to look at going back to Medicare A and B and have a prescription plan for my current Advantage? Since going on Medicare Advantage, I've developed a lung disease. Well, Pam, I don't know where you live, but unless you live in, do we know where she lives? Okay, yeah. Pam, you're probably not going to be able to do that. Lung disease would be, COPD, that typical, or maybe lung cancer or something. Then yeah, you're not going to be able to make that move. So if you've been on your Advantage plan for now more than a year, or maybe even less, then you're not going to qualify, because we have to ask you health questions. Now, if you live in New York, Connecticut, Vermont, Maine, Massachusetts, then there would be times that would be possible, okay? But if you're not in one of those 5 states, and you've been on your Advantage plan more than a year, then you're going to have to stay on that Advantage plan. Yeah, because any kind of lung disease that would be serious is declinable. And I'm sorry, Pam, that's tough. Could you repeat the redeeming provision of Social Security? Yeah, redeeming provision means that now when you apply for Social Security benefits, you're applying for any and all benefits, and you have to take the greatest amount that's available to you. So if your spousal benefit is $1,000 and your own benefit's $1,500, you're not going to apply for spousal. You're going to take your own benefit. But if your benefit is $1,000, spousal's $1,500, then again you can take spousal. So it's deeming provision says you're deemed to apply for any and all benefits available to you. You must take the greatest. The old days didn't have to do that. We could pick and choose what benefit we wanted, but you can't do that any longer. The new life. I turned 65 in February, planning on retirement at 67. What would I do next, or do I miss the entry window? Yeah, really nothing. As long as your group plan has 20 people on the payroll, the company has 20 people on the payroll or more, you don't have to do anything. If you don't have an HSA, I would encourage you enroll into Medicare A only when you turn 65. Do that. But if you have an HSA, I wouldn't do that at all. What I would do is I keep contributing to my HSA until 6 months before I retired, and keep funding the HSA. But if you have no HSA, take A only, and you'll pick up B when you lose the group plan. It's also not a bad idea to compare. Right now, the average person that is taking Medicare with a supplemental plan is spending around $300 a month. That's for A and B and their supplemental plan and drug plan, about $300 a month in most states. Some are a little higher, some lower. So if you're paying more than $250, $300 a month at your group plan, I would go on Medicare. Sometimes Medicare makes sense in that scenario. Seems Medicare A and B without something is better than Medicare Advantage. Advantage sounds like bad coverage. Just what does a 175 cover for the Advantage? Okay, Fran, I would tell you that A and B only, that's what you're saying, that would be my last choice. And again, I like supplemental plans. I just do. I love the fact I can go to any doctor I want to, almost. It takes Medicare. No pre-authorizations, permanent policy, lifetime. I love all those features. But my second choice would be Advantage. My third choice would be A and B only. And here's why. Because if you have A and B only with no supplemental plan, you're fully responsible for all the gaps. And the biggest risk on the gap would be some kind of a serious illness where you had an extended hospitalization, and the 20% coinsurance on the B side, which is all the doctor services. So you have a serious illness, you're going to have tons of doctors, and you're going to pay each one of those doctors 20%. On the A side of Medicare, your biggest risk is if you get hospitalized and you're really in a coma or something. After 150 days, Medicare doesn't pay a penny. A supplemental plan covers all the gaps on the A side, plus gives you another year in the hospital. So I would do A and B last choice. Next choice would be an Advantage plan. Why? Because at least the Advantage plan then is going to have a limit, because every Advantage plan has to have a max out of pocket for the year. Could be $3,000 a year, it could be $5,000 a year, but at least there's a limit. With A and B only, there's no limit. Sky's the limit, keeps going and going. And that's why in our country, the second largest holder of medical debt would be those people that are on Medicare. And that's shocking to me. There's $220 billion of medical debt right now in our country outstanding. And the second largest holder of that medical debt are those that are on Medicare. And that's the people on A and B. Some of those that have Advantage plans because they couldn't meet the max out of pocket. No one's in that list that has a supplemental plan because they have nothing out of pocket but the premium. A little bit deductible or something. All right, friends. So I wouldn't do that. Okay, can I still get Medicare A and B and something if I work full time and not on Social Security? You can, David, and you have to if your employer has 19 employees or less. You have to do what you're suggesting. But if you're with a large employer and they have a good plan for you, you don't have to go on Medicare. So I wouldn't do that. If you like the plan at work and it's affordable and maybe family members are covered by it, don't do anything with Medicare. And then when you retire and lose the plan, now if the plan's lousy, drop the plan and go on Medicare. All right, I've been told annual medical health checkups have to be either 11 months plus a day apart or 12 months plus a day apart in order for Medicare to cover the cost for exam and normal lab work. Okay, well, my understanding is it is 12 months. So let's say if you go in and your first year on Medicare, within that 12-month period, you do what is called your Welcome to Medicare physical, or your Welcome to Medicare checkup. There's a certain code for that, and it has to be exercised within 12 months, okay? So if you don't use that code, you don't get that Welcome to Medicare checkup, then after that 12-month period, now you qualify for what's called a wellness visit, which is less than the other, your first visit. But if you had your Welcome to Medicare physical, then 12 months later, then you can get your wellness visit. All right, so that's kind of the way that works. And by the way, normal lab work is not going to be covered by preventive. Your normal lab work is going to have to be coded as something medically necessary. So the doctor is going to have to order that. That's not going to be part of any preventive visit at all that I'm aware of. Okay, lab work is diagnostic. Doc says, hey, we need to check your cholesterol or whatever for a medical reason, but it will not be part of either one of those preventive. It is measurements, body mass, height, weight, blood pressure, heart rate, those kinds of things, medical history. That's what they're doing during those preventive visits with Medicare. So there's no blood work a part of that. Good evening. I'm already enrolling Medicare through a broker. When enrollment comes up this year, do I have to use the same broker? You don't have to. If you're on an Advantage plan, you can easily switch brokers. If you have a supplemental plan, then really your broker, then maybe they don't do much for you. But depending on the company you have, that's just tough. You don't have to. We'd be happy to help. Just reach out to us if you'd like. But Advantage plans, easy to change brokers. Supplemental plans, sometimes. Depends on the carrier. Okay, can you start Medicare and a supplemental plan without starting Social Security benefits? Absolutely. Yeah, the two are totally separate. In fact, a lot of people today are waiting until they hit full retirement age, but they're starting Medicare at 65. And so you can start your those two programs differently. In fact, I'm going to. I'm 63. My plan is to take Social Security at age 70, but I'm starting Medicare at 65 for sure. I'm 64, planning to work until full retirement age. My employer has 20 plus, offers an HSA. I read that your Medicare effective date is 6 months prior to your application date and not your retirement date. And that is exactly right. Yeah. And the reason I said retirement date, I said 6 months before you, 6 months before you retire, you apply. So they're going to backdate your A date from 6 months from when you actually make applications. So Kathy, what you're saying is right. But remember, when they backdate the A date, they'll never go prior to age 65. So they backdate 6 months or 265, whatever's first. So let's say you work until your full retirement age, you're 64 now, so it's probably either 66 and 10 months or 67, whenever it is. And so what will happen is the month you apply, in fact, let's do it right now. Let's say we apply today. We're in the month of May. They're going to backdate 6 months. So we're going back April, we're going back March, February, January, December, November. So that, in my example, I just said we backdate. We would have, if I applied today, I would have a November 1, 2023 A date. So 6 months from when you apply. So that's why we tell people when you set that retirement date, be sure to stop your HSA contribution 6 months from when you apply for your Medicare. They will not backdate B, but they're going to backdate A. Okay. All right. It's open enrollment, the only time someone can try to change from Medicare Advantage plan to a Medigap. I'm in Oregon, if that matters. Yes, in the state of Oregon, there's no special rules like the 5 on the East Coast. And so, yeah, you can only do that October 15th to December 7th and January 1 through March 31st. Those are the months you can do it. So basically 5 months. If you do it October 15th to December 7th, then your plan, your SUP would start January 1. If you do it January, February, March, then it just starts the next month. All right? On the tax on Social Security above the 25K annual income, what kind of income is it? Gross, net, AGI? It's actually, let me tell you what it is. It's a different formula. It's none of those. It is your modified adjusted gross income. So line 11 plus line 2A plus 50% of your Social Security income. So if you're making $20,000 Social Security, you would put $10,000 there and then add your line 11 plus line 2A. And those numbers together then would be applied to that chart. So if you're single and below $25,000 provisional income, zero is taxable. 25 to 34, 50%, above 34, 85%. Okay? Am I covered by Medicare when I travel abroad, or must I pay extra? Yeah, Medicare will not cover you abroad other than the U.S. territories, Puerto Rico, Virgin Islands, Guam, those places, American Samoa. That's it. So if you're beyond the 50 states, U.S. territories, you're not at all covered by Medicare. Now, if you have a plan F, G, or N, and there's actually, I think there's 6 of the plans, F, G, N, and I think it's also C, D, and M. They have foreign travel emergency benefits. It's a $50,000 benefit, lifetime, that's added to those supplemental plans. Again, there's 6 of the 10 plans that will cover you outside the U.S. And the way that claim would work is you pay the first $250 deductible, and then after that, they'll take the balance and they'll split it with you. Insurance company pays 80%, you pay 20%. But their 80% maxes out at $50,000. Got it? And that's a lifetime benefit that is not replenished. So it's $50,000 funds available for foreign travel emergency, 80-20, after a $250 deductible. Okay, Dave, I'm a client, purchased a G plan, I had a heart attack with a stent put in. The total of the bill was over, deductible and $350 out of pocket. Great company. Okay, Dave, well, I'm glad you survived your heart attack, and financially it worked out for you as well. So hopefully you're doing good. Thanks for letting us know, and thanks for letting us serve you as well. Kathleen, we have IRMA payments for Medicare 2024. If income goes down, will Medicare automatically reduce or eliminate IRMA payments next year? Do we have to contact them? Okay, yeah. IRMAs are recalculated every year. So Kathleen, what's going to happen if you're paying it now, it was because of your modified adjusted gross income in 2022. So in 2025, they're going to look back at 2023. So if you're below the thresholds, then you would not have an IRMA. Okay? And Kathleen, now listen, if you all retired this year in 2024 and 2023, then you could actually appeal your present IRMAs. But if you applied retired before that, then you can't appeal. So we can look back one or present year and appeal the IRMAs if we have a life-changing event. So every year they recalculate those. Okay? Okay, I'm allowed to use Cobra Dental and Vision with my Medicare. I just retired. And the answer to that is yes, you can. Because when it comes to dental and vision, those plans you're getting from your employer, yeah, you can use them. It's not a problem at all. Now, your Cobra is, well, let's break these up. It's a little bit confusing. So first off, when it comes to dental, Medicare is not going to hardly cover any dental anyways unless it's, something really, really serious, cancer, jaw surgery. You're going in for a heart valve replacement. That's when Medicare covers dental. So your Cobra will just probably be your primary dental insurance. So it's going to be the first payer, and we encourage people to keep it. If you can keep it 18 months or 36 months, keep it, because it's usually a group plan and the premiums are going to be better. When it comes to vision, your Medicare is going to pay first anyways. Okay, so if that vision plan offers, help with glasses or contacts or an eye exam, then go ahead and use it. But your Medicare by itself is wonderful, wonderful vision. All right, why does a person take Plan G when M is less expensive? I was told excess charges are far and few. I think what you mean by that, Cindy, is Plan N. There is a Plan M, but it is not offered by very many insurance companies. So I think you mean Plan N. And by the way, it is fine to take a Plan N. I like N plan. The N plan is... Oh, okay, she did. Okay, very good. Anyway, so the N plan's fine, and it is true that excess charges are very rare. In fact, we have 8 states that can't even, docs can't even charge excess. And so when excess occurs, and if that happens in N plan, then you would be out of pocket. And so there's a lot of people who, because there's very little risk with excess, they go ahead and go with an N plan, and that's fine. Most people are saving about $30, $35 a month. So I would never discourage someone for getting an N plan. I personally would still do a G plan only because that $30 to $35 honestly is not going to make or break me. It's not that big of a deal in my budget. And I know that I could go somewhere that charge excess. And where we see it is primarily in the cancer industry. You go to a cancer specialty hospital, that's very possible that they would charge excess. And so the $30 to $35 to me, I just soon have the peace of mind knowing I don't have to worry about excess if and when it occurs. Probably will never occur, but if it does, I don't have to worry about it. And then secondly, I don't have any copays. N has copays up to $20 for a doctor, $50 for the emergency room. And again, I just don't want the hassle of that. Other people feel differently, and I think it's fine to get an implant. I would never discourage it whatsoever. So whatever you're comfortable with. We're all different. My deductibles on my car insurance are probably lower than most people. I had claims before, and I just soon have a low deductible and let the insurance company pay for it. Okay. Does a military retiree need an Advantage plan? William, you certainly do not have to have an Advantage plan. You have A and B at first, and you have TriCare as second. And I was telling somebody earlier, the reason that some people with TriCare are getting Advantage plans is because they get what's called a Medicare Advantage only. And with that Medicare Advantage only plan, they continue to get their drugs through TriCare. But because they're doing that, the Advantage company gives them a credit on their Part B premium. And sometimes that's $150 a month. So you see a great reduction. Plus, you get the dental, the vision, the hearing, gym membership, on all those things that TriCare doesn't offer. And if you decide you don't like that system, you can get out in a year during Medicare open enrollment. It's not like it's a lifetime decision. We tell vets, try it. If you like it, stay with it. If you don't like it, get out of it. It's not a problem. Go back to A and B with TriCare. It's certainly fine, but you don't have to have an Advantage plan, but many do it because of the perks and the reduction of Part B.
I think he might have meant Plan G. It says Advantage Plan G.
I'm sorry. Okay, my bad. Yeah, I see that now. William, you were asking about a supplemental Plan G, and in that case, I would say no. I would not do that. To me, it's too much. Because if you're retired military and you have A and B and you have your TriCare, that's like a Plan F. You have full coverage on that plan. So you would not need to get a supplemental plan. Now, if someone just has VA benefits, meaning they served our country but didn't retire, then that's a whole different picture. Then those people, as long as they can afford a supplemental plan, if they don't want to be just bound to the VA system, I would tell them to get a supplemental plan. But retired military with TriCare, wouldn't do it. Okay, all righty, sounds good. Hey, listen, we're going to call it an evening. I want to remind you that we have lots of wonderful video content on our YouTube channel. Please go there, folks. I mean, literally hundreds and hundreds of videos on every single topic, and we're grateful if you could subscribe, like those videos so others can see them. There's no cost at all, and every time we do a new video, again, I did 2 today, so I try to do 2 every single week. You'll be notified about that, all right? And so please go to the channel and learn all you can, and then when it's time to go on Medicare, we'd be thrilled to be your broker. No cost for our services, and we'll do everything we can to make sure that you understand what you're doing and you make the choice with no pressure whatsoever, and then we'll serve as your broker for a lifetime. We'd be delighted to help. Thanks so much, and we'll see you next time.